We are now in the annual open enrollment period on HealthCare.gov, the federal private health insurance marketplace authorized by the Affordable Care Act. Open enrollment started November 1st and runs through January 15th, 2022. If you want health coverage that starts January 1st, 2022, you should make your plan selections by December 15th, 2021. If you wait to pick a plan until January 15th, the last day of open enrollment, your coverage will start February 1st, 2022. We're going to review a couple quick reminders of some considerations when shopping for private health insurance on HealthCare.gov. The importance of reviewing your coverage before you renew, carefully counting your income, and not waiting until the last minute. Let's talk about reviewing your plan before you renew your plan for 2022. It's always important to see what it is you are purchasing, especially when it comes to health insurance. Even if you like the private health insurance plan you had in 2021, it may be available in 2022, but it may look different. The network might have changed. The price might have changed, and some of the cost savings might have changed as well. And also, you might have changed. You might have moved or changed family size. If you had a plan in 2021 and you liked it, it is important to log into healthcare.gov and review what that plan looks like for 2022 before you choose to renew or maybe purchase something else. Now, you're going to get a little heads up if you had a health plan in 2021. You're going to get two letters, one from your insurance company and one from healthcare.gov, and likely these are already in your mailbox. The letter from the marketplace, or healthcare.gov, includes steps to take to get a premium tax credit for 2022 if you are eligible, and how to update your application for 2022. Any letters that came from your insurance company are going to tell you about whether or not your plan from 2021 is even offered again in 2022, and if not, what similar plans might look like, any plan changes in 2022, and what the premiums might look like. Now, the second consideration, carefully count your income. Marketplace savings, those tax credits and cost sharing reductions you could be eligible for, are based on your expected household income for the year you are getting covered, so 2022. You're going to start with your household adjusted gross income. That's what you report on your most recent tax return. You're going to make a couple changes based on what you know you can expect in the year ahead. Many families had unpredictable income in 2021 due to COVID, making it difficult to estimate. So make sure you take the time to review what income is coming into the house and what that looks like for the year ahead. Wages, tips, self-employment income, maybe Social Security or SSDI that is coming into the home. But again, remember, when you are counting income, you do not include things like stimulus money. You do not count SSI, nor do you count anything that could be considered a gift. Income counting resources are available. There are a couple calculators online. The first one is right on healthcare.gov itself, an income calculator that can help you as you estimate your household income. We also make our own FPL calculator available to help get you started. There also is a subsidy calculator that the Kaiser Family Foundation updates every year. We link to those three in the description below. Now, finally, the last point, which seems like the easiest but can be the hardest to follow, is to not wait to the last minute. Allow enough time to make those comparisons, get all the information together, know what the premiums, networks, covered services, and costs will be for the plan that you will then be in for the year ahead with your family. Use the comparison tools and the filters that are available on healthcare.gov. And if you discover you need help, make sure you find those local help resources linked up on healthcare.gov itself. Or if you are in the state of Wisconsin where we are, you can visit wiscovered.com. The closer we get to the deadline, the busier the helpers will be. So make sure you start early and know what your questions are so you can get them answered in time to make the best plan selections for 2022. In the description below, some instructions on how to get started. Healthcare.gov, those links once again to find helpers in your area. Also a checklist of what to have handy when you start your application.